Hi everybody, Governor Roy Cooper here. We owe a deep debt of gratitude to our veterans who have fought for our freedom and safety here and abroad. You and your families have made tremendous sacrifices to give my family and me our freedom, and I'm so grateful. North Carolina is the most military-friendly state in the nation, with almost 800,000 veterans who call our state home. When veterans decide to leave active service, it's our obligation to help them transition to civilian careers and get access to the support that they've rightfully earned. I established the Governor's Working Group on Veterans Affairs, which focuses on job creation, health and wellness, as well as legal and financial services for our veterans. We're committed to continuing to ensure that our state is a great place for military families to live and work. Veterans, we are forever grateful. Welcome home.
Welcome home, warrior. With so many options, it can be overwhelming sorting through what resources and benefits you may qualify for. NC Serves is there to help you navigate every step of the way and connect you with everything you have earned through your service to our nation. Our Veteran Resource Guide has over 200 pages of federal, state, local, and nonprofit programs to assist you and your family.
Because of technology, we're all just bombarded with endless information. You can Google something for veteran services and it's just mind-boggling. And people are busy. They're going to work, they're going to school, they're raising a family, they're trying to do their hobbies, they're trying to have a good work-life balance, and they're trying to navigate a resource, and they get frustrated and often give up. So when you have a central point like NC Serves, you come in and say, I have been very frustrated getting connected to this particular resource. Our community coordinator will say, understand, what do you need, and we're going to get you there, and we're going to streamline it. When you walk in our doors or get connected to us virtually, we can get you all your services, and we're going to be honest with you about what services you can and cannot get, what you're eligible for. Maybe you're not qualified for that service, but our main services: housing, shelter, employment, benefits, navigation, social enrichment, legal, substance abuse, counseling, mental health, physical health, you name it, and we're going to find it. And if you don't think anybody can help you, I actually ask, please ask us. You don't know until you ask and until we've navigated through the community. And if it's a need that's not being met, we want to know that. Our partners are amazing. They'll come together and say, we're going to find a way to meet that need. Never underestimate just how committed communities are to taking care of veterans and their families. Not handouts, taking care of them. Giving them great employment opportunities, affordable housing opportunities, access to good medical care, those quality of life issues, those needs that everyone wants. I was surprised just how robust it really is. And then when you ask a community partner, most of the time they say, yes, let's help, let's partner. You may land a good job, but after a while, you're missing what got put into you, which is this sense of mission. And then your purpose. It's like, well, I have a good job, but I don't feel that same purpose anymore. And even veteran spouses will tell us that. Getting connected to us, we'll get those social connections to where if you want to volunteer, great. If you just want to get on a in-person or a virtual coffee, we have all those options to where you kind of get that purpose again when you come back into the community. And you get connected with fellow veterans, and it's often people you knew and even served with. It's a small military in the grand scheme of things, and that sense of connectedness is what we want you to have. I love this because the community has come together. This work is hard. It's tough. It's tough on us. We focus a lot on self-care and taking care of our local team at NC Serves, but also our providers. But at the end of the day, we can say, hey, we made this community better, one veteran at a time.
Welcome home, warrior. Your service to our country came with great sacrifice and quite a few benefits. The Veterans Benefits Administration and our network of state and county veteran service officers across North Carolina are ready to help you identify and file for all the benefits you may qualify for.
Veterans, or rather soldiers, men and women, we're not accustomed to asking for help. We just jump in and do it. However, that could be a barrier for you coming into the office. We want you to come into the office today to assess just what's going on with you. We want to take care of you now.
The VA Regional Office assists veterans transition from military to civilian life. We assist with disability compensation, pension, education, veteran readiness and employment, and home loans.
Some services that a lot of veterans don't think of are the women health. I'm very proud that in 2014 that they're open an office specifically for us women in our health issues, because we too do serve this country.
I'm most proud of assisting veterans that live within our community. These are our store clerks, our postmen, the people that we interact with every day, and we assist them to help better improve their quality of life.
For the veteran that is just transitioning out of the military today, we would like to meet them where they are. However, for that veteran that have been out for a number of years, we would also like to explain and or get him or her into the office for those benefits he or she has earned.
One of the biggest challenges is that the VA system is quite confusing because we have so many benefits to offer, which makes it overwhelming to decide. You can meet with us and we could help navigate through those and see what you're eligible for.
Please visit one of our offices because you have earned these benefits. If I had to give a veteran any advice, one thing would be to register at the nearest veteran healthcare facility or seek medical attention through your private provider. Transitioning from military to civilian life is very tough. Please allow us to service you as you have served and protected this country.
Welcome home, warrior. For many service members, continuing their education is at the top of their list. When separating from the military, you may have questions about higher education. How do I find the right school? How do I pay for school? What about my GI Bill? Here in North Carolina, you have many options, many of which can be found in our Veteran Resource Guide. Our friends throughout the UNC system, our community colleges, and private universities are waiting to help you make your next chapter a successful one.
Walking in the doors can be pretty daunting, especially as you look at that transition process. So Daniel and I, both going through the transition process ourselves, understand firsthand, some of those challenges, and they're hard to navigate. So starting at a university, it's who do I talk to, where do I go? That is why we exist. We're here as kind of that case manager, that first line of contact for them. So veterans, being a non-traditional group by nature, they have unique experiences. So I think maturity goes along with that, and it's not just an age thing, but it's an experience thing. So they're more worldly in their views. They have families, a lot of them. They live in homes, they have mortgages, they have full-time jobs. So the way in which we serve our veterans and the military families, it's going to be much different than what it looks like for a traditional student here at the campus.
Here at NC State, I work with our Veterans Education Office. Primarily here, we kind of are the administrative arm of really supporting our students on campus, meaning we can help our military-connected students with military withdrawals, advising questions, registration questions, GI Bill benefits. So if they're using benefits, we can assist them through the enrollment process and receiving those awards that way. And that's really what our focus is to kind of really support them holistically through an administrative process.
Veterans that come to Wake Tech find a place at the center where they can chill. They can meet like-minded veterans, they can discuss their concerns, they can receive assistance if needed, and then they can be successful in what they want to pursue. We are here with a veteran zone so that they can come in and talk to some of their fellow veterans. They can learn about all of the programs that we have. We have Student Veterans of America Club. We have a Salute, it's a Veterans Honor Society, and we're here to help them be successful, but also that they can be with a group that they can relate with.
The Veteran Zone is where it's at. I mean, because it's as real as you can be in there. You're surrounded by a bunch of combat veterans. We all done the same thing. We get each other. I was lost when I first got here. I was scared, and this is where my place of comfort was to be around other like-minded people.
I think important to us is treating every veteran and service member and family member separately. They're individuals. While each of them do have common transitional challenges, they're all unique in terms of what they're going through, and if we treat them that way, then they're going to respect that, and they're going to reach out for us for assistance when they need it.
Welcome home, warrior. What's my next career? Upon entering civilian life, it may be difficult to figure out what's the next chapter of your career should look like. Workforce Solutions and NC4Me have a wealth of resources to get you the tools, the training, and information you need to find a new career with purpose and potential. Employers across the state of North Carolina are eager to hire our veterans.
I believe that if you have served this country, you can certainly serve in any company in this country. NC4Me understands that it's difficult to transition out of the military into a career in the civilian workforce, so we have created NC4Me to make that transition easier. We are going to allow any of our veterans, our Guard and Reservists, our spouses, and our transitioning service members to connect to companies across North Carolina by simply putting their information into our Career Connection tool. NC4Me employs a team of individuals that are veterans, that are military spouses, so they understand what you've done in the military, they understand the sacrifice that you have made, and they're really good at educating employers on the value proposition of what the value really is with military talent.
We are North Carolina Career Center. In general, we provide a variety of services. Employment services, career assessments, assistance with resume, assistance with workshops, and any of the employment services that we have to offer.
A lot of veterans don't seek help. And I think by having an organization like NC Works and Career Center with all the programs, it's another outlet to help them. A lot of times it's easier to blame somebody for your mistakes, and it's kind of hard. It's kind of hard for you when you're blaming so many people to, like, you know what, hey, I need to take a step back and look at myself in the mirror and seek out that assistance. And I think by, this organization, it's the gateway. It's just, it opens up the doors. Hey, here are some things that we can do for you. If we can't do these, then here go other avenues and other resources that we can provide for you.
We have a team of individuals that understand you, that are veterans, that are military spouses, that help create that connection with employers across the state. So we make sure you're taken care of from the minute you come into our organization and working with us to the minute you exit, and hopefully grab that career that you're going to love for the rest of your life. North Carolina believes that if we trusted you with our country, we can certainly trust you with jobs across our state.
Welcome home, warrior. North Carolina is fortunate to have 4 VA medical centers, over 24 VA clinics, 6 vet centers, and many state and community partners available to assist you with medical care that you are entitled to for your service to our nation. Don't hesitate to reach out. They're all there to serve you.
The state of North Carolina is committed to being the most veteran-friendly state in the U.S. Veterans who live in North Carolina may be eligible for care from the Veterans Health Administration, from non-VA resources, or from some combination. If someone is enrolled in VA healthcare, they should expect to get primary care services, and the primary care doctor can then help them figure out if they need access to specialists. I think one thing that younger veterans don't realize is that they are as eligible for health care as some of the older veterans or those that they've seen that are suffering from physical wounds of war. There are also the invisible wounds of war, and one of the things that veterans should think about is the toll that service has taken on them psychologically, and whether that's something that needs to be investigated.
Here at the Vet Center, we do individual counseling, we do marriage counseling, we do family counseling, and we do group therapy. When a veteran gets out of the military, there's a lot of difficulty transitioning from being a veteran to being a civilian. The Vet Center can walk you through that process and get you to where you need to be. Not only do we serve veterans, but we serve active military, including Guard and the Reserves, as well as their families. And One of the new services that the Vet Center offers is bereavement counseling for family members of anybody who's died while serving on active duty.
One of the hallmarks of the VA is that primary care serves as the anchor for the whole system. If a veteran seeks health care at the VA, they will be assigned a primary care provider who will perform a comprehensive assessment and get them connected to the resources that match their needs. Behavioral health care is now integrated into primary care.
At the Stephen A. Cohen Clinic here in Fayetteville, we service post 9/11 veterans, active duty service members with a TRICARE referral, Guardsmen, reservists, and their family members, all regardless of role or discharge status. If they've worn that uniform for more than a day, they're definitely welcome to our care. As soon as they walk through the door, they've made the first step towards their mental health issues. Here at the Cohen Clinic, our clinicians provide brief evidence-based, client-centered therapy all on an outpatient basis, as well as we provide case management services and resource referrals for things that are like finances, education, housing, and as well some of our clinics do provide transportation to and from the clinics within a 30-mile radius. We also provide child daycare in certain clinics.
It shouldn't matter whether a veteran lives close to a VA hospital or a VA clinic, or whether they live in rural parts of the state. They deserve and are entitled to excellent health care. A lot of new technologies have come into play so that veterans can access care through their home.
The Cohen Veteran Network, or CVN, telehealth video therapy is what we use. It essentially creates our clinic becoming a clinic without walls. This allows our clients to be able to receive care right from the comforts of their own couch without having to leave their own home.
It's important for veterans to remember that they serve their country with distinction. No matter which era they served in, what branch they served in, or what their role was when they were active duty, healthcare benefits are important and will partner with you in your journey.
All right, thank you all for coming today, and welcome to our August North Carolina Governor's Working Group meeting. Today, a very exciting meeting because you're going to get to hear from all of the subcommittees that have been developed and what they are working on for the state of North Carolina. If you want to get email updates, just go to ncgwg.org, sign up. There's Uncle Sam says we want you to be on our email list, and sign up. If you want to come to Joint Force headquarters and join us in person, you will need to sign up on Eventbrite so you can get through the gate. And so we hope that many of you will begin to come and join us on a monthly basis. Live streaming is currently taking place on Facebook. Please share on your pages, share on your veteran pages, and let's get this information out to the masses. So Secretary Gaskin could not be here today, and his team is otherwise occupied. Terry Westbrook's currently at the National Association of State Nursing Home Directors Conference out in San Francisco. So, and that's what it says, the State Directors of Veterans Affairs, so NASDAVA, as they call it, had their annual conference last week. keeping those guys on the road. Secretary Gaskin and Legislative Director Wes Scott and Mr. Westbrook attended. Many issues at the federal level being discussed out there, and we hope they are pushing to help veterans and improve our systems. The National Association of State Veteran Homes, as I said, is their conference is taking place right now. And you'll be hearing the briefings again today from our subcommittees. We look forward to that. And the CVEB initiative is gaining a lot of momentum. What does that mean? It means that COVID has settled down a little bit and people are able to get back out, get together, discuss the things that we need to do to move forward in all of our initiatives in North Carolina, to include improving mental health access for veterans, suicide prevention, a lot of things going on that you'll hear about today. And the CVEB is the Community Veterans Engagement Board that meets in different regions in the state, bringing together a community of collaborators to help push all these initiatives. Multiple construction projects still happening at the State Veterans Home and cemeteries, either in progress or they are getting ready to begin. The department is finalizing its legislative priorities, which I will talk more about when we talk about benefits. They will be providing these to all of you in the future, and so we can all speak to our representatives in our areas and encourage them to push through the initiatives we want to see happen for our veterans. Subcommittee reports, again, going to be shared today. The governor has issued a proclamation in support of the Employer Support to Guard and Reserve program, and they'll be scheduling a ceremony to present that soon. Operation Greenlight, another initiative that's coming soon, and you will see some of that after today's presentations. State Veterans Home experienced a small COVID outbreak. Currently, they have a cumulative total of less than 5 personnel positive, and all those are scheduled to rotate out of the protocols this week. The vaccine program has been very effective, and so that is a very low number for a community setting like that. Continue to encourage everyone to get vaccinated, stay vigilant, wash your hands, wear your mask in crowded areas, et cetera, et cetera. Empowering the subcommittees of the Governor's Working Group to not only identify issues, but coordinate those solutions and results so that we can transform our Governor's Working Group into a group that is actually working for our veterans every month, pushing through these initiatives. So today we have Paul Cruz, Network Director of Vision 6, giving us an update from the Veterans Healthcare Administration.
Good afternoon, everyone. It's great to be here. It's been some other faces I see in the crowd now as well. Good afternoon. It's good to see everybody. It's been a while that I've not been able to make it, and I apologize for that. This new role has me traveling around to a lot of different places, so trying to get my schedule done. But I want to just go through a few things with you today, just to talk about a few items, some things that are changing or have changed here in Vision 6, so North Carolina and Virginia. Very first, I think I'd talk about leadership change at our facilities here in North Carolina. We've had 2 changes in the last several months. The very first, I think you've heard about, is at Durham, actually replacing my position. In May, we had Dr. Alicia Smith, who came here to be the Medical Center Director for the Durham VA Healthcare System. She came from Phoenix, so she's been well tested. And has done a great job out there and has recently moved here and getting started here at the Durham VA. I'm also very happy to announce a new addition to our team, and that is the new Executive Director for the Salisbury VA Medical Center. Some of you may know him. He's recently retired Colonel John Melton. He was most recently working for DHA, and before that he was the Medical Center Director at WOMAC. So he has joined us and has been boots on the ground now for about a month now at Salisbury. So excited to have him on board and what we're working on. I want to talk to you about what new change, and this is really about trying to get into having better access for our veterans to get in contact with medical services, any services through the VA or the VHA side. And it's called the Clinical Contact Center. And I'm actually not going to read through all this. I think I want to take you guys to the next slide, which is kind of a picture that depicts, a graphic that depicts all the different ways that you can access services to get into the VA. Right now, there are basically 3 ways that you can contact the VA. Very first, is there a lasery thing on this? Oh, there is a lasery thing. The very first one is the crisis line, and something I think that's very important. I don't know if you've heard about it or not, but we have a new number that is available. It is an additional number. It is not a replacement number, but that is now 988. It's a national number. You can press 988 and press 1 for Veterans Crisis Line. Very excited about this. We're seeing a lot more uptake. People don't have to try to remember that 1-800-273-8255, I think is what it is. Hey, I do have it in my head. I can't believe that. But I do have it on my business cards and I have it on my phone. And now I've got to change it to 988. But I think it's really important if you can, whatever you can do to help us get that message out about the new 988 number, a very important change. Of course, we still have our My Healthy Vet, which is a great program where veterans can get information and get information about their health care, follow up on their appointments, medication refills, get information to and from their doctor through secure messaging. Not only do I run the VAs in this area, but I also am a client, so I'm a frequent user of those tools, and I think one of the best ways to communicate with my doctor, actually, and it's very quick, is through secure messaging. And so really trying to get the word out. Instead of trying to use the telephone and getting somebody on the phone, use secure messaging. It goes straight to a nurse who's watching that, and he or she will pick up very quickly on that. So I really do encourage folks to enroll in that. Of course, there in the middle, we have our legacy ways, which is calling to each of the medical centers or some of the other numbers that are out there that will get you through to different bodies. Through extensions and sadly still voicemail. We're trying to work on new programs to enhance that. And then a couple of new things that are coming along. And one is the VA Health Chat, which is kind of one of those chat bots, but it'll also get you in touch with somebody who is responding to these text units, and then we'll be able to communicate with veterans that way if they want to talk over text. And the last, which will have its own 1-800 number, but does not yet, is the contact center, the clinical contact centers. And right now, you can access that clinical contact center. It does work by calling, sorry, that's me, okay. By contacting the facility number, and a call will send you off to the clinical contact center. Once you get to this clinical contact center, there are multiple things that you can do, 3 of which were already in existence today. The very first is doing appointment management. We now have over 100 people that are just sitting at these contact centers receiving calls 24/7, not 100 24/7, but over the 24-hour period of time to manage your appointments, answer calls about appointments, and direct calls where they need to be. There's also a first response clinical resolution center where they can actually help a veteran who is having a clinical issue, or if he or she is having some kind of minor health care issue, that they can get some advice. They may be able to be directed to where they need to go be seen, or see if they can get an appointment in the next 24 hours. Already in place, the last is the pharmacy services, where you can connect up with a pharmacist so you can get your medication refills, find out information about your current medications, or just get any general information you may need about medications through the VA system. And the new program that is getting ready to start is our virtual clinic system, where we will have providers that you will be able to be connected to in a virtual mode. So if it is something that you need to be seen for, or a veteran needs to be seen for in a reasonable amount of time, like less than 24 hours, you can be connected up with an emergency room doctor who will then take your call, and you will be either video or voice discussion to talk about what your issue is, possibly prescribe medications for that or whatever you may need, or give you direction about where you need to go. We're real excited about that. It's not only going to be emergency room doctors, it'll also be nurse practitioners and physician assistants that are going to be virtual on this system to be able to provide immediate care. Of course, we do desire that our patients and veterans go to their primary care provider first, but we know that there's those instances where they may not be able to do that. And to that point, just want to make a quick reminder to folks about something, and that is about emergency room care. Last year, we spent over $10 billion nationally on emergency room care. Veterans going straight to an emergency room, probably majority of it was probably because it was something that was an emergent issue, they needed to get there quickly, and that's very appropriate. But we saw a large amount of it was just because they had a sniffles or they had a cold or they had some kind of an issue that was very minor in nature. And it's just to remind folks that we do have an urgent care benefit. So you can go to myva.gov or just va.gov and actually put into the search box that you're looking for urgent care. It'll bring up a network participating urgent care programs in your zip code where veterans can go and get that care provided. For certain, it all depends on your service connection, but for most of the veterans, the first 3 visits are for free, excuse me. But after you go over that 3rd visit, then certain veterans, I think it's under 50%, don't quote me on that, service connection, but under 50% service connection, you actually would then, for the 4th visit, would have to start paying a copay of $30. Why do we do that? Because we really do want to get you back into primary care where you're managed and into our system instead of getting care outside of the system. But just a reminder of folks. The last thing that I want to bring up and talk about quickly is that there will be a change coming soon. If any of y'all have been to any of our medical centers and done your check-in for appointments, it is usually done these days through the kiosk system. It's a kiosk that you go up to, type your information in, and it'll check you in automatically so you don't have to stand in a line waiting to speak to somebody. There is always still a medical support assistant there to help you. This new system is kind of coming into the modern age, and it will be a QR code smartphone activated check-in system. This system you'll be able to scan. When you get to the facility, you'll be able to scan a code. It will check you in automatically after you've been registered in through the program. There will be people when this rolls out in the next 2 months, there will be staff at all of our kiosks and our check-in areas to train folks on how this works so we can make sure that people understand and don't get freaked out about it. We'll also have a lot of information coming and more information to come to educate and like to get out. We'll probably get people out in the community to start educating as well. So those are some of the updates, and I will hand it back over to... Oh, well, okay.
I just wanted to say I'm also a frequent user of your systems, and I appreciate them. I really do.
Cool.
Use urgent care, use the crisis line. We got to meet the new director in Salisbury last week at our Veterans Benefits Live event. He is eager to collaborate with our community, so thank you. We are very, very, very happy to have him. And up next, Mr. Mark Beles, Executive Director of the Winston-Salem Regional Office. I'm sure he's got some news for us on that Veterans Benefit Live event.
Good afternoon, everybody. It's great to be here today. Excited to give you some updates from the VBA side of the house. I'm going to start with the PACT Act. I'm sure everybody's heard of this. On August 10th of 2022, President Biden signed I'm just going to call it the PACT Act because it has a real long name. We're really excited about this new legislation. This is really an opportunity to take care of veterans who have asked for this for years and years and years. I know as I've been over the past 6 years getting out and about around the state, that's been one of the biggest questions that I've been asked about is burn pits and environmental exposures over in the Gulf War region. One of the other things that I've always been asked about is hypertension as a presumptive disability due to Agent Orange, and that was included in here also. So I'm not going to go through a lot of the details here. If you notice on the bottom of the slide, va.gov/PACT. PACT. That is a VA website that is constantly being updated with new information, I recommend you make that one of your favorites and keep it close to you. And whether it's something that is of benefit for you or for somebody that you meet, this is something that's really, really important. But I do want to touch on a few important points about the PACT Act. One, it expands and extends eligibility to VA health care for veterans. And I think that that's important, and it's something that that I know folks have asked for. It also gives VA the ability to decide service and grant service connection for over 20 toxic exposure-related type conditions. Most of these are respiratory and cancers, and that is something that's important. It also expands certain locations of Agent Orange presumptive exposure and also radiation exposure. So there's very specific places in there that have been included that weren't there before. So there's a whole lot of other things. I'll be giving further updates in the upcoming months on this, but it's a long time coming, and I know a lot of veterans have asked for this, and we're really excited to start delivering these benefits for everybody. I want to talk about a couple veterans benefits events that are occurring, and the websites are on here, and we also have a couple flyers that I know will be posted to the Governor's Working Group website. One is Hiring Our Heroes Virtual Career Summit. You can see that there is a link here for that. One of the questions I frequently get now with the PACT Act is, what is VA doing to make sure that you are properly able to handle the influx of work? I can tell you that coming up to the vote and eventual passage of the PACT Act, VBA has hired over 2,000 additional claims processors nationwide, and that's something that we're going to continue to look at and probably hire more and more people. So that's something that's important. The other thing that we're doing is looking at automating some simple processes that right now it takes a human being to do. This is going to create a much more efficient process and allow our folks to spend time on the things that they really need to spend time on, and making sure we get these decisions out as timely as we can. So there's a lot of hiring. I think that's going to be going on. There's one of these career summits that's coming up on the 31st. But also keep your eye on USA Jobs. That's something that if you know a veteran or know of anybody that's looking for a job, there are constantly going to be jobs posted there over the upcoming year that will be an opportunity for folks to help serve veterans. One of the other VBA events that's coming up virtually, and again a link here, and we'll be posting something to a flyer to the website, is a virtual veteran suicide prevention symposium, and this is something that is a huge priority for the Secretary and our new Undersecretary or acting Undersecretary, and it's something that we need to pay very, very close attention to. And this is an event that will help folks to be educated on suicide prevention. So two great events coming up, and I encourage you to participate in those if you can. So just the takeaways here at the end, the PACT Act. I mentioned VA is hiring, usajobs.gov, and the event, the suicide prevention event coming up. We also, in partnership with the state of North Carolina, Crystal and her friends, and General Gaskin, and with VHA, we hosted an event in Mecklenburg County in Charlotte, and saw well over 800 veterans in a 3-day period. We had a lot of folks participating in there. I know the Veteran Bridge Home participated, and many, many others that I was able to talk to as I visited the event last Thursday. It was really, really successful. We were able to help a whole lot of veterans. We had over 100 inquiries about the PACT Act while we were there. We also were able to grant numerous benefits for veterans, and I think we took something like 50 new claims of veterans who never filed claims before. So that was good in getting somebody signed up and into our system. So very, very exciting. Last thing that I have is we continue to be open to the public, of course, and I think I'm going to take this off the slide, but everybody knows that. We've been open for 2 years now to the public, but One thing that's coming, and we're just sort of putting the final touches on it, is for our office in Winston-Salem, it's often difficult for veterans to come in because there isn't parking. And it's a facility that is in a downtown area. We don't have a parking lot. One of the things that we've been working through, and we hope to have completed by October 1st, is a voucher system for parking. So if a veteran is coming to visit the regional office to see VA, we're going to be able to, if they park in a certain lot, we're going to be able to, we've had a contract with this lot to be able to validate their parking tickets, so won't have to pay to come in and see VA, and we're really excited about that. That was quite the challenge. We're just waiting for the parking garage to put the equipment in that they're supposed to put in. So I guess there were delays in some of that equipment coming over. So as soon as that's up and running, we'll be promoting that. But I wanted to at least put that out there for all of you. And one last thing, I'll remind everybody that we have partnered with the Wilmington and Greenville Healthcare Centers to have a virtual VA benefits system set up at each of these facilities where you can make an appointment, you can come in, and you can actually talk to one of our trained counselors in Winston face to face over the virtual world, and that's something that's been really successful, especially in Greenville. They've done an outstanding job, and it's something I want you all out there to, if you live in those areas and you want to talk to somebody face to face, it's an opportunity for you to do that. And you can talk to folks when you enter the healthcare center. They can help you and direct you in the right direction. So I think that is all I have. Thank you.
Thank you so much. We had a really good time at Veterans Benefits Live in Mecklenburg County, and I would like to thank my VSOs personally for everything that they did at there. We have a team of 13, including myself and our director. We were supported by NCDMVA, Region 1 manager, the field operations manager, NCDMVA Clemens, the state service office, Cabarrus County, Union County, and gosh, don't let me leave anybody else, Edison, but Cumberland County, yes, it was wonderful. That Iredell County also came. That support, we could not have gotten through all those veterans without that support. And the biggest question I got asked is, what is a VSO? What does a VSO do? We are veteran service officers. We assist you in your claims process. So we got to educate a lot of veterans, which is what all of this is about, is educating veterans about their benefits. And these committees that we are going to hear from today are all about educating the public about what is available for our veterans. So with that being said, next up, Renee Rader, Assistant Director for Policy and Programs for the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. I had that down pat when Michelle came, and I'm trying to learn it again. Welcome, Renee. Thank you for joining us today.
Hi, good afternoon, everyone. It's always a pleasure to be here. I'm glad to be back this month. I'm sorry that I missed last month. We have had some changes in our leadership structure at the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services, which is why I was absent last month, but I wanted to bring those to your attention. So our Director Avula has left the Division of Mental Health and has moved on to other things. We are actively recruiting for both a division director and a deputy director, chief operating officer. In the interim, we have Deputy Secretary for Medicaid, Dave Richard, acting as our director. And we also are being supported by the Deputy Secretary for Health, Mark Benton. I'll try to bring one of them along with me next time. They really were excited to talk to this group, but were not able to attend this month, but hopefully we'll be able to bring them with us next month. That recruitment for those two key positions is going strong. The positions have been posted. They are now down. We're in the interview stages. We're hoping to identify final candidates by the end of September, which seems kind of long, but it's really important that we get some strong leadership within our division, and also looking for some folks who will have some more longevity. I think I've been with the division for, I've been with the department for 12 years, but I've been back at this division for 3 years, and Director Avula was my 4th director. So we're really looking to establish a leadership structure that is stable. Other important leadership changes, the Veterans Liaison position, I'm happy to say that we managed to fill that position. It was a long time coming, and that person is scheduled to start on September 6th, I believe, the day after Labor Day. I will definitely bring her with me next month, and we're very excited to get her on board. I'll be reaching out to a lot of you that I'm looking at in the audience to help us with her orientation. She is an Army veteran, and her most recent experience has been in social work and education, but so excited, lots of positive energy. She's really eager to get to know all of you and get back and start developing those relationships. The other thing I wanted to mention is we're also in the final stages of hiring a replacement for Dr. Michelle Laws, who used to attend these meetings for our division. She was the assistant director for stakeholder engagement. We're in the final stages of hiring for that position, and hopefully that person will be on board by October 1st. Wanted to talk just briefly about Medicaid transformation and the tailored plan implementation timeline. This is in the 5 years, we have been working towards reforming the Medicaid behavioral health system yet again, and standing up what we're calling behavioral health tailored plans. Those are scheduled to go live officially on December 1st, 2022, so we're in the final countdown, and it looks like we're on track for December 1st, 2022. But I am pleased to say that the implementation has started in earnest. We are at the open enrollment part of Medicaid transformation. Folks will be auto-enrolled into their tailored plan for their area, but there are choices in terms of people with Medicaid for their primary care provider and their tailored care management provider. So that is going on. I will say that the information that's going out is very complex, and we do have enrollment brokers available for people with Medicaid who have questions or concerns about the process, what they need to do, and how they need to enroll. Super quick, I wanted to also talk about some funding opportunities we have at the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. I always like to bring those to your attention because veterans are a priority population for our division, and we're always looking for opportunities to partner with our veteran serving organizations. We do have 2 requests for application out right now. Both of them are in our primary prevention space, so looking at preventing substance use and misuse, including alcohol and other drugs. We have 1 RFA posted right now that's closing very soon. It's about $1.8 million, which will split between 3 to 6 sites for assessment and evaluation, and then also training, technical assistance, workforce development in the community, and some other statewide special projects. The other RFA that we have out right now is our prescription drug opioid overdose related death prevention. That's the name of the grant that we received from the federal government, which is why it has such a long name. But that's going to be $50,000 per year up to 4 high-need communities, and that will focus on paramedicine activities, naloxone distribution, and some other activities in the community. So if you're at all interested, please take a look. If you have questions about that, you can always reach out to me, and I will get you connected with somebody who knows the answers to your questions. The last time I was here, which was 2 months ago, we talked about the opioid settlement funds and how our division has been given a portion of those funds. I think it's over $750 million that'll be coming to the state over the course of the next couple of years. But recently we have been awarded almost $16 million of those funds. And we issued an RFA, and we had over 25 different community providers apply for these funds. We had prioritized 4 specific areas. One is employment and transportation. One is expanded evidence-based treatment options. One was improvements in the criminal justice space, so pre-arrest and post-arrest diversion programs, for example, or treatment while people are incarcerated, or linkages as people are exiting incarceration, and also to develop supported housing services. Now, I put in the slides so that you can have, for reference later if you want to read them, a list of all of the different organizations that we have selected and awarded grants to. I'm not going to read them all to you, but I know that a lot of folks caught up with me after the last meeting and asked for this information, so this is just for you to read later if you're interested. I also gave a little bit of a summary of what each of those organizations will be doing. We had a lot of interest, especially in the criminal justice system. So we're really focused with these grant funds on the criminal justice system now. So that's very exciting. We are just now developing our scope of work with each of these providers and doing the contract process, which can take quite a bit of time with the state. And so we hope to see some of these programs start to be implemented in October, November. I will also mention 988, the Suicide and Crisis Lifeline. I mention it wherever I go, so we are very excited about that implementation. I will say it started on July 16th, and again, it's just a new number. It is not a new service. We've always had the suicide, not always, but we've had the Suicide Prevention Lifeline in North Carolina for quite a while. With this easy to remember number, we experienced I think it was like a 40 times increase in calls just over the first weekend. We have a number of grants that we have been using to increase our staffing. So when you call the 988 Suicide Prevention Lifeline, you can speak to a trained crisis counselor who can work with you, talk with you, help de-escalate any crisis that you may have. They also have the capacity to link people with referrals in their community. They can link them with the LME MCOs who have behavioral health services that they can link folks with, and also the future tailored plans. The other thing that they have the capacity to do is link people with emergency medical services and emergency crisis services if they need them. So if somebody calls the crisis line and they are in immediate danger, the 988 folks can dispatch emergency medical services. We continue to offer the existing number, which we couldn't remember earlier. It's 1-800-273-TALK. So that number is still in effect and will continue to be so. The other thing is we're working on text and chat options for people who don't like to talk on the phone or can't talk on the phone. So very excited about all of that. We also, I didn't put this up here, but we are also beginning to implement our media campaign. This has been pretty well advertised on the national level, and so the word is getting out, certainly. But here in North Carolina, we want to increase our efforts in that area. So we are developing a campaign so that we can have live radio and streaming radio announcements. We're going to do videos on YouTube. You know, the little videos that you have before you watch a video, the little advertisements, we're going to have space there. We're going to do some billboards, and I'm sure I'm missing something, but some other forms of outreach. And that's just phase one of our marketing campaign. We want to continue to increase people's awareness of the number so that people can get the crisis services they need. And then finally, since I'm from the Department of Health and Human Services, I just wanted to make mention of monkeypox and the department's efforts in that area. Certainly, we have increased our education and outreach around that. There are a number of events. If you check our website for informational webinars and seminars, you can get that information there. And the one message that I am making sure that I purvey everywhere I go is that vaccines are available for people who qualify and need them. And I think that's it.
Thank you so much. So the VA sent us some 988 media clips type of things that you can put at the end of your email. So I would challenge you all to add that to your email signature panel. And I'm going to ask all the subcommittee chairs who come up to please introduce the next subcommittee chair. And first up is the Subcommittee on Housing, dear colleague and good old friend, Brandon Wilson. Thank you.
All right, good afternoon, everyone. I'm going to try to drive this thing, I think, Crystal, right? Before I start, I just want to say a special thanks to the Department of Health and Human Services, specifically the division, Renee, your team. I'm fortunate enough to be on some national committees and get to see what other states are doing in the VA space, but also with their state Department of Health and Human Services. And our Department of Health and Human Services and the division here in North Carolina are far surpassing a lot of states in their commitment to veterans. And that is something that we all should be very proud of. And when Renee and the division talks about some of these things that they're doing at a very big level that doesn't seem like it's registering to us, it does affect our veterans and their families in a very specific way. And they've kept that at the front of their decision. So, Renee, I just want to say thank you to you and your entire team and Cody for that continued commitment to veterans in North Carolina. Started with Flo Stein, and she's here. So, real quick, real brief, what you see there is our subcommittee we have right now. This is not a committee that is set in stone. If you look at this committee and you see some of these good-looking faces and you look at some of the organizations that they work for, what we've tried to do in this housing subcommittee is took leaders and subject matter experts from the VA, from the state, from the public sector, the private sector, and different elements of housing a veteran out of homelessness and veterans looking for affordable housing as well. And so we've took this at first glance, and it does breathe. This is not set in stone. So if you're interested in being on this committee, feel free to reach out to myself. Our contact, I think, is on the governor's working group website. But we've started this. This is very elementary, all right? So what we're trying to do here is take you through a little bit of what we're looking to do. And so I'm going to do that here. There's our mission statement. In general, in gist, what we're wanting to do is create some KPIs that's going to be able to compare apples to apples between the VA and our LME MCOs, which those two entities probably never talk on any kind of regular basis. But the LME MCOs have housing programs. The VA has housing programs. The community has housing programs. So we want to get on the same equilibrium to talk about what's really working and create that foundation so we know what we're talking about and how we're communicating with each other to build out what we want to do. And ultimately bring that back to the governor's working group and to the chairs so we can start making really strategic decisions moving forward with all the entities involved. Here's our goals that we see right here for the year, and the yellow is highlighted because that is where we are at right now. The first thing that this group is wanting to do is we are going to identify 2 to 3 key performance indicators or KPIs that we can discuss across all these levels, and we're going to talk all these levels, and we'll talk about that in a second, but also service gaps within this, and ultimately lead to capacity, because ultimately we want to know, does the Veterans Life Center have capacity? Does the Restoration Quarters in Asheville have capacity? Does the Onslow Community Outreach, who doesn't have veteran beds, but they are shelter beds veterans can tap into, what is their capacity? So we're going to try to figure out where we're at so we can report that here, because a lot of people tuning in and in the audience has a veteran. And if you know about these resources and know they have beds available, we can get veterans off the street. Second thing we're going to talk about there is our awareness. We want to enhance and expand that, hopefully with a new resource guide that hopefully will be printed out pretty soon. And then obviously at the advocacy level, both to the VA and to General Assembly, as well as our state departments. I'm going to skip that slide because this is a slide I want you to look at here. What we've done here is we've decided that we want to break down those KPIs and the service gaps and capacity in each one of these buckets for housing. It's not necessarily in order because we know some veterans transition into a different pocket. Some may just need transitional housing and don't need shelters. Some veterans transition out and just need affordable housing. And so we've looked this into shelters, rapid rehousing, transitional housing, permanent supportive, and then home ownership. And so what we're working on now is to have a report out to the governor's working group on what each one of these entities across the state are doing and what the capacity is for them. From our SSVF providers to our GPD providers to our Taylor Plan to Troy and affordable housing. What's the affordable housing market look like across the continuum? And so very elementary. It sounds a lot of complex, but we're taking this very macro level, very simple to start because we've got to have something that we can go off of. And so that's sort of where we're at. Here's the vision. I didn't want to put a vision on here, but they made me put a vision on here, and I'm a good enlisted Marine, so I do exactly what I'm told. So there's our vision here where we're looking at how to incorporate from our CVEBs, obviously to NC Serves, and all the other entities and health benefits and social drivers of health that affect a veteran's housing and getting into housing. And that's sort of what that other slide there that I went briefly by. You can see medical, behavioral, and mental are also often failure points in a veteran's journey into affordable housing. And so this was not our slide. This is actually from the Calgary Homeless Foundation, and the VA uses this model quite a bit when we talk about that journey. So that is a quick 5 minutes. That's what we wanted. And so now I'm going to welcome up fellow colleague, good friend, the man, the myth, the legend, Mr. Dave Roddenberry, to come up and talk about health and wellness equity.
This is just like my last family reunion. Hey, I'm Dave Roddenberry, work for the Governor's Institute. I'm representing the Subcommittee on Veterans Health and Wellness Equity, and on behalf of my co-chair, Brenda Monforti, who unfortunately couldn't be here today, but is listening in. Starting out with a mission statement, this really just boils down to we want this group to pursue equitable outcomes for veterans, service members, families, and when we say that, we mean that relative to what we're experiencing in the population as a whole. You know, we come here day in, day out. Every month we listen about how veterans, military families are more at risk for suicide. They're more at risk for homelessness, obesity, you name it. Every one of those things, there's a study somewhere that says, well, veterans probably have that. And so we're looking to close that gap. You know, this really comes in the form of research-driven initiatives. And so, you know, we want to be very, very careful, very steady in you know what we understand to be the problems and the gaps, and to create awareness campaigns to inform the public about what we do have, to inform lawmakers and policymakers about what we don't have and what we need. And of course, you know, diversified delivery options and smart expansions on new programs. Oh, I guess I should use the label on the back of it says you shouldn't be touching this, Dave. Subcommittee goals. First off, you know, we want to start out with a quick win, and I think that developing a set of recommendations for the Secretary to carry forward in support of what we hope may already be or is in the works, an executive order supporting the Ask the Question campaign that outlines what happens if someone says yes. So you're a DVOP in Sampson County, or you know, you're housing or whatever, somebody comes in your office, you ask if they're a veteran, they say yes. Okay, great, you've asked, but then what? So it, you know, becomes pushing resources like NC Serves, NC for Vets, all of the VA resources that we have available around the state, and putting those in the hands of the people that need them. And I think that that's something that we can get knocked out by the end of the year. This one's a little bit more ambitious, right? A detailed gaps assessment for veteran service providers at all levels in North Carolina, and as well as looking outside of North Carolina for a barometer of how we're doing, right? Because at the end of the day, I wake up just to beat Texas. That's the only thing that drives me. That's because Texas State never sends me any alumni stuff. And so that is, I'm going to be very frank, that is complicated, it's lengthy, and it's expensive. And so, without the ability to solve for two of those, the end product will definitely suffer. So we're trying to take our time and do that right ahead of our annual reporting that is up in April. Finally, identifying and assembling a key panel of stakeholders. Much like this, as a bit of an addendum or an add-on to Governor's Working Group. Like Brandon said, this is ever evolving. Hopefully, we're going to add two new names that are affiliated with folks in Salisbury to this list very soon, and it's never going to be long enough. Many hands make light work. We got a lot of work, and we'll never have enough hands. So you're going to hear me ask for additional membership every time. Of course, Brendan Monforti, my co-chair, and I want to take just a second to talk about our quantitative and qualitative analysis. Mike Bressler, who works for VA and is working closely with UNC School of Public Health on a similar research project, has been gracious enough to take on the qualitative piece of this, to dive into the literature, to bring forth those subject matter experts. And Moses Gloria is following that up with real faces, real human stories that can speak to some of these issues. Our KPI list is also going to be ever-changing and always incomplete. If we're looking at a very broad set of leading indicators, we want to look at active programs. Where are they? What do they do? Who do they do it for? And what are the gaps in between? What county is left out? Service types, right? We have service dogs, and we've got housing, and we've got all these things that can improve outcomes. But the better we understand who offers what and where, the better we're going to be able to organize the provider database on NC for Vets and the resource guide, which comes out every year, and B, that's going to feed the gaps analysis quite a bit. And so really the outcomes are lagging indicators that we expect that if we're starting to close the gaps in some of these social determinants of health issues, that we will see reductions in suicide rates. We will see increases in per capita income, decreases in public health utilization. And with the caveat that, to be very frank, we've had a tough go of retrieving our NC Serves data, working with Care 360 and the state of North Carolina, and so that continues. But it's just one of those things that really highlights how difficult it is to really get valid data out the door. Vision, really quick. I mean, this is a a little bit repetitive of our mission statement, but it just comes down to better informing policymakers, community leaders, and philanthropic funders. So I added philanthropic funders in there because we have to understand on the private philanthropy landscape, all of those initiatives are driven by what the funders want. I can go as a nonprofit, I can go up to Howard and Sherry Schultz Foundation to say, hey, look, I'd like to do X, Y, Z, but that has to match their goals. And so we have to tell them what the goals are. We have to tell them how that money can be spent most effectively. And then we'll start to see the landscape of programs and services orient better towards where we want to fill in those gaps. And I think that's about it. I'll hang out for questions offline, but next we have Bradley Wren with the Subcommittee on Education.
Hi, folks. My name is Brad Wren, and I'm the Program Manager for Military and Veteran Education at the UNC System Office. So, Dave, we're also in the business of beating Texas every day. I really appreciate the opportunity to be here with you all and share kind of what we've been doing on the Education Subcommittee. I don't know if you've worked with academics before, but like the rest of them, I like to talk. So I'm going to do my best to follow the advice of my old NCOIC and keep the briefing briefing. All right, I pushed the right button. Oh, no, I didn't. Wait. I pushed the wrong button. So, mission statement for the group. The fact that we got a bunch of folks at the university level together and all came to a common understanding of a mission statement is in itself a win. But we decided that the mission of the committee is going to be to build and maintain a collaborative advocacy network of stakeholders really along 4 dimensions. So you've got the UNC system, the community college system, independent colleges and universities, and then other state level and local stakeholders who are affiliated in some way with the military and with education. Wrong button again. It's all right, we'll get there. Subcommittee goals. So the first goal is to develop consistent definitions and data collection protocols with regards to military affiliated students. This seems like a no-brainer, but it's something that is really inconsistent. I mean, from school to school, from system to system, just on very common terms, like a military affiliated student. What does that mean? Are you talking about everybody who's a veteran, active duty, Guard, Reserve, spouses, family members, all of them together? Are you just talking about spouses and family members and calling the other folks military students? Spoiler alert, everybody does it different. And so one of the things that we're trying to do is to develop some common understanding among the systems of those kind of key terms so that we can measure things like graduation rates, retention rates, persistence rates, and have that be an apples-to-apples comparison. I mean, you can imagine if you've got one school listing everybody, service members and family members, as a military-affiliated student, you've got another school, just spouses and children, and you ask what the retention rates and graduation rates for those 2 schools are, you're going to get a lot different information, just by nature of the fact that they're defining that one thing differently. So yeah, the next step of that, I don't want to get too far. I told you I like to talk. Before we start measuring those outcomes, we got to make sure that we're doing apples-to-apples comparisons from school to school and system to system. Goal 2 is to make sure that we've got consistent and comprehensive support services for our students. Again, across the systems, folks, there's just, it doesn't matter if you're living on campus in a dorm. There's some things that your school just can't provide for you. I came from UNC Greensboro, and I worked directly with students there, and I've had students come to me asking me for, lawyers, emergency housing, things like that. And, at the time, I didn't know what to tell them. And so we're going to be working with some strategic partners to make sure that we are able to provide, or at least offer, wraparound services to all of our students. And we're looking at having a system in place for doing just that by the end of the academic year. Goal 3 is optimize military training and experience credit articulation systems and processes. This is basically course credit, college course credit for military training and experience. There's no reason that an 18 Delta medical sergeant needs to take a class on how to give an IV. They've been putting bullets into people and taking them back out at the same time, hanging out of a helicopter. So, they don't need you to teach them how to do a head-to-toe assessment. They know how to do it. So, this is creating a uniform and understood and established methodology for articulating that training and experience into actual course credit that is then itself portable from system to system. The UNC system President Peter Hans has just signed a regulation that mandates this and really is built on Senate Bill 761 that really mandates it for everybody. But it has provided us at the system with a way to sort of codify that and sort of structuralize it. And the hope is to roll that regulation out or some version of a similar regulation out to the community college system and to independent college and university system. And that's an ongoing project. I wouldn't want to give you a timeline for that. It involves a bunch of IT that's well over my head, and we're still trying to determine what that timeline looks like at the system level. So as far as a statewide rollout, we'll see. So I guess that'll be updated soon. Goal 4 is to educate staff, faculty, and applicants and students and family members about the specific needs of military-affiliated students. This is going to have 2 parts to it. One is we got to refresh the what's commonly called the Green Zone training. Green Zone training is for academic faculty and staff who work with military students, teaching them about military culture, about military lifestyle, about transition challenges and logistical challenges and things that they might encounter when working with service members. The current training is great, but it has a lot of dated information. And again, it's something that schools have taken and sort of made their own and changed in small ways. And we would like to have a statewide, common and consistent training session so that we make sure that we're giving faculty and staff equal sets of tools and experience that they need to best serve our military students. The other piece of that is educating folks about their VA benefits, VA education benefits, so GI Bill. It's super nuanced stuff, and a lot of times, you've got somebody who's Chapter 35 eligible, they hit their 100% P&T, and they haven't been in service 15 years. So it's been a long time since they had that SEP and TAPS briefing about how your GI Bill works. And so, we want to develop a training program that gets them up to speed on how they can effectively use their benefits for themselves and for their families. The other folks that this is going to help out is academic advisors. There's some unique challenges that students have when they're applying for courses and following through with a particular plan of study and using the GI Bill to do it. And a lot of times academic advisors at schools don't know those nuances and aren't tracking some of the challenges that are inherent in that process. And so that training is going to pull double duty. It's going to be educating the public on how to use their benefits, but it's also going to be used as a supplement to the faculty and staff Green Zone training that is specifically targeted at academic advisors. We've got a pretty good group here. I know you all probably have worked with some of these folks, and you know that they're rock stars. I've always been told that the key to a good team is never being the smartest person in the room. And I can tell you that whenever we meet with this group, I am by no means anywhere near the smartest person in the room. So I feel like I'm winning at that. And so we've got our overall committee, and then we've broken down the committee into 4 fire teams. Then each one of those 4 fire teams is going to be dedicated to one of those goals. And you can see there's some repeat names on there. Those are my superstars. But we're looking to grow those as more and more people get into the group, just like everybody else. These groups are really dynamic and fluid. And so if you know of anybody who has a particular passion about education, veteran education, military student education, please refer them to this group. And I'm going to stick around after this presentation too to answer any questions and hand out my contact info. KPIs, and so what are our deliverables here? What are we actually going to be doing? And so for the data goal, we're looking at a document-based list, so basically a Word document PDF that can be shopped out to the different systems that has, here's the term military-affiliated student. Here's a commonly understood definition of what that means. Here's what we mean when we say active duty. Do we include AGRs on that? You'll find out in the definition. So having that document crafted by the end of the academic year is going to be the deliverable for Goal 1 and Fire Team 1. Goal 2 is 50-plus faculty and staff trained in mental health first aid at the systems, and that is at the UNC system, the community college system, and independent colleges and universities. The goal is to really get anybody and everybody who works with students who are or have been in some way affiliated with the military mental health training. I know I don't have to tell you all how important that is to our community, but that is something that I feel personally very passionate about. And so we're going to train folks up in mental health first aid, and then we're going to establish a primary point of contact for wraparound services at the UNC system office, at the community college system office, and the NCICU office. And that way that if there's any student on any campus, whether they're public or private, community or 4-year, they're able to access those comprehensive resources and services that may go beyond what their school is able to provide. Goal 3 for credit articulation, like I said, we're looking at rolling out the regulation that President Hans at the UNC system signed out to the independent colleges and universities and to their presidents and chancellors, and to the North Carolina Community College system. Hopefully we'll have some consistent verbiage with those documents as well, and we can sort of work together to make sure that no veteran chooses a school strictly because that school is offering them more credit than another school would offer them. We should be offering them the same set of credit, and then letting the student and their particular fit with that school determine where they go. And so goal 4 with training, we're looking at PowerPoint-based training slideshows. One is the refresh of the green zone, and the other is focused not only on VA education benefits, but also DHS and DoD tuition assistance and the inherent nuances and troubles that that students run into when using those programs. I didn't really have a good vision either, so I just wanted to take a second and give a shout out to some key partners. I'm fairly new to this group, and I have been very welcomed by its members, and a couple of folks in particular. Dave and the Governor's Institute has basically funded us rolling out this mental health first aid training to people at the community colleges and independent colleges and universities. Otherwise, we wouldn't have been able to do that. And that is, to me, nothing more than proof positive that the Governor's Working Group model works. If you get the right people in the same room talking, things happen. And this is something that has happened. We've already rolled out our first training session. We had 9 folks trained in mental health first aid, and there were folks from independent colleges there. There were folks from community college there. There were folks from external agencies there. It was great. We were all holding hands and singing Kumbaya. It was wonderful. And also the folks at VBH, I know I don't need to tell you all about the great work that they do, but Paul has worked with me directly and helped me get set up on the Unite Us software platform so that I can make sure that our system students have access to the resources that VBH offers. We're looking to push that out to community colleges and independent colleges as well. I'd like to have at least somebody at the system level for all three of those areas, if not at particular schools. And then the long-term vision is going to be continued. I know you heard me say it several times. Consistency, equity, and parity across the systems with regards to anything and everything that can help our military-affiliated students graduate and be successful. And I like to end it with that statement: get them in, get them through, get them out, and get them jobs. That's the vision. That's what we're trying to do. And that's all I got. So I think next up, oh, no, that's not all I got. Or yes, it is. That is. All right. That's all I got. Next up, the illustrious Blake Bourne.
Thanks, Brad. Great to see everyone this afternoon. Thank you very much for having me. And I'm going to jump on the Texas bandwagon real quick, or off the Texas bandwagon. No offense to any Aggies in the room. If you're not on the inside joke, the Texas Veteran Network, if you go to their website, they'll tell you it was the first interconnected network for veterans services in the country. Not true. Patently false. Launched in 2020, according to the Texas Veteran Network. That banner right there, NC Serves, was started and launched in 2015. It was fully statewide in 2017, and now served over 20,000 veterans with more than 45,000 services. So North Carolina is beating Texas, and I know that I'm preaching to the choir here. But to build on what Brandon said, that doesn't happen without the vision and the support from Flo Stein and DHHS, and then the implementation with Jeff Smith, and then to have Renee and her team and DHHS continue that support. That's what allows North Carolina to be there. And so we're grateful and honored to be a part of that. Really grateful to have Brandon's team to the east and the coast for the NC Serves Network, and excited that we're going to continue to beat Texas. So. And I want to give a quick shout out to both the VBA and Mecklenburg County for the work that we did last week in Charlotte. I walked in thinking it was a benefits action center, but Mark, I swear it was just a race to see Corey Mabe or Crystal Miller who could get more steps up and down that hallway. I still want to see the pedometer and who had the most, but it was great to watch community partners in action for 3 straight days, and we were grateful to be a part of that. I get to lead the subcommittee on social enrichment. It's sort of feel guilty because that's usually what social enrichment looks like, right? It's pretty fun, it's engaging. There's a lot of different ways that our veterans and their families are working together. And when you ask most military families, veteran families, what do they miss? We miss the people, right? We miss those relationships. Those are hard to find. But what we've identified are there are a lot of great ways to plug in the community. And we feel like the importance of measuring social enrichment comes back to the inverse of social enrichment, which is social isolation. If we're not connected, it's been identified several ways that has a much higher likelihood of suicide if we don't address this key factor. So building friends and family, building a community can address a whole lot, not just, hey, I had a good time today on a Saturday, right? We planted some trees, we had a coffee, we had a lunch, but really it can be an access point to so many different things. So here are some of the actors and the partners. Would love to see more. I'll echo what Dave said. I will never not invite folks to be a part of this. We need to broaden and deepen our relationships in the community. Larry, I think you might be thrown under the bus here. Your Sergeant at Arms said that he could do it, but now I think you might be a part of that as well. But if you know anyone that represents veteran community engagement, social enrichment, that knows and understands how important it is to bring our veterans together, then I would love for them to be a part of it. Each of the groups that are represented here represent different examples of that. You've got Victor, I'm going to work from the bottom up. Aaron Harper, formerly at Atrium Health, right, bringing together multiple ERGs. You've got Don Timmons, everyone knows Don, right, the godfather of veterans coffees. American Heroes for North Carolina, really raising the narrative of what veterans can be, counted on in their community through several great events throughout the year. The VFW and American Legions, of course, our legacy VSOs are very important to this work, and we want to make sure they're represented. Humana Military, a great healthcare partner that's done work, and Andy has lived on several sides of this effort. And then, of course, Veterans on Wall Street, Victor Perez, and then, like I mentioned, the Veteran Council. So those are the members. Here's the mission statement. It really comes down to making sure that we have an understanding of where veterans are intersecting in their community. Where are they meeting each other? Where are they making and building relationships? If we can understand that, then we can understand how to better coordinate across all these other functions to find the veteran. We can't care for him if we don't find him. All right, so I'm not a good Marine. I'm a bad Army officer. So, sua sponte for any Rangers in the room, or do what you rank and handle for everybody else. The goals and measures are pretty cut and dry. And to be honest, we need to start just capturing some basic baseline understanding of who is collectively bringing veterans together. Where are they doing it, and what exactly are they doing, right? It can look like volunteer projects. It can look like workouts. It can look like coffees, happy hours, large Veterans Day parades. I honestly don't mind if it's a church or a CrossFit gym. I care that veterans have 20 to 30 people, a platoon of folks who will go, hey, where was Larry today? What's he up to? How's Larry's wife doing? How's Sheila, right? If we have that and we can build that in every county and every community, then I think we're on the right track. The reality is it's probably already built. We just don't know that it's there. So the good news is it's probably not actually there much to build. We just have to start tracking it and know how to capture it. That's where the measures come in. If we can figure those things out, we not only raise the visibility, there's some real problems and real challenges and real barriers our veterans face on reentry after the military, and because of exacerbations of their military service, right? We've heard it, healthcare, education, housing, unemployment. But if we also show all the positive things that are happening, right, it gives a counter narrative to the veteran experience, and it can welcome and include a lot more veterans. But we've got to figure these things out, and I won't read these for you, but I think these measures are important because what it allows us to do is identify key locations by geography and group around what's happening, raising the awareness of how to plug in, right, whether you're in Randolph County or Mecklenburg County. Identifying gaps. If this room and our network of people and that subcommittee can't find a group that's coordinating and organizing veteran events in a certain area, then it's probably not happening. That's a problem. We have to identify these gaps and map who is already engaging veterans. And then we really need to look at what are the demographics and what's the health equity piece, to echo Dave's earlier point, right? If we're only doing one type of event with one type of veteran on one type of day at one certain time, we're missing people. So if we're missing people, then we're missing the opportunity to invite them into this community and continue to make a difference. A future state, I'm not going to create the vision for our committee. I'm going to include those members and any other future members to set that vision alongside me. And then what we hope to do is not only have some quantitative measures, but have some qualitative measures. Edison, how connected do you feel to your community? How professionally connected do you feel, right? How socially and engaged do you feel like you can make a difference in your community? When you grow up in the military, we're sort of built to serve, right? Well, what does that service look like, and do I still feel that way? We need to qualitatively understand if veterans feel connected to their community. So I'd love to get there, but we can't figure out those qualitative measures until we tackle some of these quantitative ones. And ultimately, if we can identify where veterans are living, working, playing, then we can figure out how to best care for them and their families. There is amazing work going on right now, from the VA on down to all the nonprofits, the over 2,000 nonprofits that are connected through NC Serves. But if we can't let those veterans know about it, then we're much less likely to be able to serve them. So that's what the Subcommittee for Social Enrichment is on. Like Brandon, I'll be around afterwards. And yeah, there's my contact information. Thank you very much. Oh, I get to reintroduce Crystal Miller, the real rock star.
All right, I didn't follow the rules at all because I'm not an officer and I'm not a Marine. Okay. So one thing I'd like to do very quickly, Edison, you mind coming up and let me introduce you to everybody, let everybody see your face. Edison Platt is the new Field Operations Manager for the Department of Military and Veterans Affairs, and he is my co-chair and my colleague, and I just appreciate him so much. I just want to introduce him very quickly. Edison, say hello to everyone.
Hello, everyone.
Thank you so much. I wanted you to see his face because he's going to be integral in this group. All right, so how does North Carolina stack up? Sorry. So my director said horns down, boomer sooner. I don't know, y'all. I'm not about all that stuff. So I am going to probably make some people upset when I get through the bottom of this. Here's our mission statement. What do we want to do? We want to increase access to benefits for our veterans, and we want to increase those benefits for our veterans. Because I promise you, as I go through my presentation, you can Google what are the best states for veterans to live in. What are the 5 best states? What are the 10 best states? North Carolina does not pop up. It doesn't, which is an issue, right? That is a really, really bad issue that we are not even in the top 25 of states that veterans want to live in or military people want to retire to. It's shocking, I know, because I feel like our state's awesome. So what do we have in our state? What do we have? We've had the NCDMVA with a secretary who is reporting directly to the governor and has the governor's ear. I feel like they support us very well. As we're coming from NCDMVA and now working for the counties, I appreciate our relationship so much, as I do with Edison. We work very well together. We have a Veterans Affairs Commission. The commission's responsibility to the veterans of our state is to make sure that they are pushing our legislators to pass legislation that supports our veterans and what they need. And if they're not doing that, then we need to push them to represent us because that's what they're there for. The Veterans Advisory Council, they stand up, they fight for us. That's veteran service organizations across the state. Mike, you are the Sergeant at Arms, right? Nice. So they are there also to be a voice for our veterans. So my favorite people in the world, the state and county veteran service officers. The veteran service officers in North Carolina are better and more equipped, sorry, all the other United States, than any service officers in the United States. We have over 200 accredited service officers who carry accreditations from the NCDMVA, American Legion, National Association of County Veteran Service Officers, DAV, and some of them have gone even further and have additional accreditations. Our service officers are there, and most of the time, the first contact a veteran makes with our systems. All of the systems that we talk about here, they are at the center of that circle. And we have an ability now to teach them more about the social determinants of health and make sure that those service officers are able to direct those veterans where they need to go for the additional benefits. Everybody's not eligible for federal VA benefits. Everybody's not eligible for VA health care. So then we have to turn to Department of Health and Human Services. We're all in this together. And so I feel like they really work well together, and they are my favorite group of people. We have an excellent relationship with the Winston-Salem VA Regional Office. I did not list the members of the committee. It's a little loose right now, but I do have Chris Warges and Corey May from the Winston-Salem VA Regional Office, Edison, the regional managers for the Department of Military and Veterans Affairs. And as y'all saw, Dave has me on his committee. He doesn't know it. He's also on mine because we work together. All right. So I decided to go on with some of the benefits that North Carolina does have. If you're 50% service connected, you can get a reduced hunting and fishing license. If you're 100% permanent in total, you get up to $45,000 in tax exemption on your property tax. You get a vehicle property tax exclusion if your vehicle is modified due to your service-connected disabilities. Military retired pay is North Carolina tax exempt, as well as service-connected disability, DIC, survivors benefits plans for surviving spouses. Those are North Carolina tax exempt. You can get free military and veteran tags and veteran indicator on your driver's license. We have 4 state nursing homes, almost 5, We will have 5 soon. We have 4 state cemeteries, beautiful, all beautiful places. Veteran spouse, veteran preference for state employment, and state licensure based on, so some of that falls under the education. If you're licensed, or you are a journeyman plumber, you can get your plumbing license in North Carolina, so that will move over. And then education, we of course have the Children of Wartime Veterans Scholarship. It's not bad. What we have to offer is not bad, but it just sometimes doesn't measure up. Federal resources, North Carolina. We have the state cemetery, or national cemeteries. Of course, only one's taking burials right now. There's a list of VA medical centers and outpatient clinics, healthcare centers, and vet centers. And then I put the GDX numbers on here just to give you an idea of what's coming in for the state of North Carolina. It's over $5 billion coming into North Carolina. That's in service-connected disability payments, dependency indemnity compensation payments, burial benefits, and pension for veterans, and a death pension for surviving spouses. That's a lot of money coming into North Carolina, and Lois Harvin Raven puts it best when she went to her commissioners in her county. She said, this money, so a veteran gets his service-connected disability check, and he goes to Walmart and he buys his family groceries, and the Walmart stocking guy gets paid, and he's paying his babysitter, and the babysitter is paying for her insurance because her mom and dad won't pay it anymore. Like, those dollars are spent over and over and over again, which is why it's so important that we support our veteran service officers in the state. Look at the health care that has been spent on veterans. Those are veterans that don't have to be on Medicaid. Those are veterans that are getting free health care from the health care system. And then education. I mean, who's paying for education? VA's paying for a lot of education. That's federal monies coming into our state, and it's important that we educate our legislators about how important it is to take care of the people who are spending that money in this state. So how are we measured? Benefits, taxes, cost of living, health care, or more specifically, access to health care. Employment opportunity, median pay, unemployment rates, lifestyle, census, housing stability. That's where all the information on these next pages come from. So some of the top states. These come from different sites. Different states vary. What are the top states for veterans benefits? California, Texas, New York, Iowa, Florida. The biggest thing is that property tax exemption. For 100% permanent and total veterans, there are a whole slew of states, they're listed, who have a complete property tax exemption. That has been tossed around in our legislators with our legislators for several years now, and it keeps getting knocked down. If you want to help us help our veterans, talk to your representatives and tell them, go check and see which of your representatives have voted for these and who have voted them down, because that's going to make a difference in this state when we get people who support veterans to represent us and vote yes to the things that matter. So I'm not going to read through all of these. I do want to bring up the Texas Veteran Land Board. That really stood out to me. Texas will give a $150,000 loan to veterans to buy land with a very small down payment. I mean, that's a pretty big benefit. Their education benefits are really good too. So Texas is number 1 in a lot of places. So I don't know why not Texas? I heard y'all all talking about Texas. So they have the full property tax exemption for 100% permanent and total veterans, and they have a tiered property tax exemption for other veterans that are 10% and more. I have friends and family who are veterans in Texas, and I would love for them to move home, and they will not. So they have no state income tax. That's another thing. The Hazelwood Act actually pays 150 hours of tuition free at state schools for dependents and spouses of veterans. That's an entire degree. That's a lot. And they do it for all of them. Like, it's not, like, you don't have to compete for it. You don't have to, that's a very good benefit. I highlight full property tax exemption again. And that's something that's huge. That's why a lot of our veterans live in South Carolina. right? They come across the border, they work in North Carolina, but they live in South Carolina. Waives out-of-state tuition fees. We do that for our service members here in North Carolina. I didn't put that on my list, but they do have a lot of programs there. Again, Alaska, their property tax exemptions up to first $150,000. That was the third. Nevada, I was a little confused about Nevada and why it would be such a good state for veterans to live in, but it's got a lot to do with job opportunities, not just these benefits, but it's got a lot to do with job opportunity and cost of living. And then Illinois, again, completely exempt from paying property taxes on their primary residences. That is something that you will hear a lot from veterans, what veterans want and what they deserve. All right. These are all the states, the 17 states that have that homestead exemption, and I really want you to talk to your representatives about pushing that. How will we know when we're doing better? When we get this passed. That's one of our measures, when we get this passed. Another way that we will measure, we will continue to use the GDX, because that GDX tells us how many veterans are enrolled in VA healthcare, right? How many of our 688,000 veterans are enrolled in VA healthcare? Not enough. How many of our veterans know anything about veterans benefits? According to the Veterans Benefit Live, a lot. They just saw a veterans benefit, they came, and then they learned what they could be eligible for. So many Vietnam veterans that have never filed a claim before, that have hypertension, who say, I'm good, I'm being taken care of, I had a good work life. What about your spouse? What happens to your spouse when you are gone and she's trying to pay the bills, but your income's gone? How about you go file that claim for that hypertension now, please? Again, just another top 10. These are for military retirement. It's just to compare. North Carolina's not there. I want North Carolina to be there. It should be there. We have a good state and we have good veterans programs. What are we doing well? We're coordinating with our federal, state, and community entities through the Governor's Working Group, the CVEBs. We have the Veterans Benefits Live in our town. I hope that, or in my hometown, I hope that we see a lot more of those next year. I think we have another one in Wilmington this year. Is that correct? October, November time frame. We will have another one of those in Wilmington and the Outer Banks. So we will have those dates for you. We have NC Serves. We got Veterans Bridge Home and ABC. More suicide rates than most of the Southeast region. And we have NC for Me. Those are just a few things that I put that we are doing very well. We just need to continue to add to that. Those are, we're excited. If you want to look up some of those, you just need. Brian here? Hi, Brian. Welcome. So the subcommittee on healthcare, and you'll see how these all overlap. Brian Seghetti, also on our Governor's Challenge to Prevent Suicide, which we're going to kick back off really soon. Welcome. Thank you.
Good afternoon, everyone. My name is Brian Sangute. I am the Division 6 Coordinator for Suicide Prevention and Homeless Programs. And I see a lot of familiar faces because we've been part of the Governor's Challenge for a while. And I want to say that Stephanie Young, the director for Asheville VA, could not make it today. As you can imagine, that's a around 4-hour drive, so I'll be here to represent her. So straight to the point, the status. We've already identified members. In fact, we had to cut down because there was so much interest within the VA. We have providers from different disciplines. We've also reached out to community partners, and I'm going to mention one of the key people who just joined us recently. We also have reached out to community resource groups, folks who we can invite who have subject matter expertise on a particular area. So they might not be part of the ongoing membership, but if we need them, we can invite them over. So far, we've held about 4 meetings. We've completed a charter, which will guide how we operate. And we've identified metrics and goals. We shall discuss with the members because, as you all know, the VA has been doing suicide prevention and other healthcare related things for a while. And so we don't want to impose our own VA metrics on community partners. We want to collaborate and cooperate so that we identify what makes sense for different communities. I can tell you that in my role, I look at different metrics, no less than 10 different metrics. And so I'm mindful of the fact that that can be overwhelming. And also we want to make sure the metrics we identify are interoperable with our partners in the community. Some of the ones that we think are universal include outreach events. I can tell you that at the VA, we have a metrics for that in different levels. For example, in suicide prevention, we encourage and actually we require suicide prevention coordinators to do outreach events, not only in service within the facilities, but outside in the community. And we track that and set benchmarks for that. And so in this subcommittee, we'll make sure we identify the ones that make sense. We also recognize that communication is a key part to everything. We want to make sure that we open up and break down silos so that there is open, close communication and cross collaboration and pollination of ideas. And as I mentioned, suicide prevention, we have solid data. Thankfully, the Office of Mental Health and Suicide Prevention program has been putting resources in the right place. So we have predictive modeling where we identify even veterans who might not know that they are at risk of suicide way before they reach a crisis point. And we start reaching out to them, doing outreach, identifying some of the stressors, like it's been mentioned. And as you all know, oftentimes that sense of belonging is a key part of that sense of contributing to society is also very important. But also sometimes things change in life. All of us, as we progress in our lifespan, we encounter different stressors. And a lot of times, some folks might reach a point where it's really difficult to reconcile some of the things that are happening. And we try to do the best we can. And we'll continue doing this in the subcommittee to make sure we're able to reach those veterans before they reach that point. Number of resource intercept maps in North Carolina and number of health partners is another metric that we're going to be tracking very closely. As I mentioned, the VA is just one part of the solution. We have big healthcare systems in the community. We have the small healthcare systems in rural areas. We have independent practitioners, and we want to make sure we reach everybody who serves our veteran citizens. And for our mission, this is something we crowdsourced among the members of the subcommittee. And so we wanted to be succinct and straight to the point. And so our mission statement here is to identify and disseminate best practices and resources in health and well-being, ensuring North Carolina's veterans receive safe and effective healthcare services in a culture of equity and safety. And from that statement, you can see a theme here. It resonates with maybe some of the other subcommittees. We want to make sure everybody is taken care of very well in the best way we can with the resources we have. We are actively developing a veteran resource guide and map, and I know NCSAV has done a fantastic job. We are reaching out to our individual organizations and seeing what their individual resources, real time that works is, because as you can imagine, some organizations that were here three years ago are no longer here. So we want to make sure the resources that we develop are actually effective and real time and useful. We don't want people to rummage through pages and pages or websites and websites that don't work. As I mentioned, we will be inviting community partners to present on different topics. So the takeaways and next steps, as I mentioned, it's an active process. We continue cultivating goals for outreach, communication, suicide prevention, and identifying key stakeholders to help us develop resource maps. And I can tell you that looking at emails every morning, I can see submissions from different areas, which is very encouraging. And as I mentioned again, we want a tool that works. We want a live, dynamic resource. But we also acknowledge that this is going to be a challenge because that involves resources and the appropriate applications to do that. And we might collaborate with other subcommittees who might be already working on that. We are, again, working towards monitoring metrics for this. And with that, I'm going to stop and see if Crystal might take over. Thank you.
All right, thank you, everyone. That's all of our subcommittees. If you want to be a part of any of them, you can find our contact information at NCGWG. You can get in contact with any one of us. I did not mention our benefits committee is meeting the last Wednesday of each month. Wanted to bring your attention to the Operation Greenlight for veterans. There's a county toolkit available. Get those green lights out and show a shine of light, of hope, and support for our veterans. You'll see green lights everywhere. Here is the supporting Operation Greenlight for veterans. What do you call it? Thank you, proclamation. I lost my words. Yes, there it is, set out by the governor. Mental health first aid. So the Governor's Institute has a grant. They will be doing mental health first aid training across this entire state. How does that help all of us? So one of the committees talked about Ask the Question campaign. That is priority one for the Governor's Challenge. That is a priority for Changing Lives Together in Mecklenburg County, which was the Mayor's Challenge to prevent suicide. Flo Stein, myself, Paul Berry, and Nicole French went to the Innovations Conference that SAMHSA hosted for those programs. And we are finding some momentum. So I found out yesterday I've got access to about 6,000 gun locks for our priority 3 to safety, lethal means safety, which is awesome. And Edison's going to help get those out. We decided it come from Gary Kuna that if you're handing out a resource guide, you should also hand out a gun lock with that. It just goes hand in hand. So the mental health first aid training is going to help our communities come closer to helping us to preventing and reducing suicide. So if you have groups that want to do that, we're going to be working those in. Reach out to Dave, reach out to myself, Veterans Bridge Home. We can help point you in the right direction. Our next meeting is going to be September the 22nd. It is in person. Again, you can go to NCGWG and sign up for email updates so that you get that link to sign up on Eventbrite. Is there anything I have forgotten today? Everybody go home and Google who is my representative and how did they vote and go talk to them, all right? We're going to push our agendas forward and gain some momentum in making things better in North Carolina and being the really, honest to God, most veteran-friendly state. Yes, sir. You sure can. Paul Cruz is going to come back to us.
So I know she's getting ready to close out. I just wanted to make one statement from the executive committee, and this is really to all the chairs of the subcommittees. I know this is a lot of work that we've asked you guys to do, however, I'm really impressed by what you guys are doing. Just looking today at what you have put together, pulled the people together, the vision statements that you have. It's really exciting for me to see the work group, governance work group, doing this work and breaking down and looking at these social determinants or these factors and seeing how we can change the state of North Carolina for the betterment of our veterans. And I know we don't pay you anything. Wait, do we get paid? Yeah. We don't pay you anything to do that. I know this is a collateral duty that you've got, but I really just want to say, at least from my standpoint, from the executive committee standpoint, I know General Gaskins, Mark, others that are on the executive committee, thank you so much for what you're doing. This is very important work. This is going to move North Carolina in the right direction. I've actually had the opportunity to speak to some folks nationally and in VA, meaning the Secretary and others. They're very excited about the work that's being done here in North Carolina and what you guys are doing to move the state forward. So I just want to leave you with that and say thank you very much for what you're doing. Thank you.
All right, everyone, please stay with us after the program. We are going to sit around the microphone so everyone can introduce themselves and what they are doing and do some networking. Again, Governor's Challenge, Benefits Committee, you saw all the committees. Please join us. Please be with us. Dr. Harold Cutler is here with us today, as always, and we will be meeting soon to try to get that momentum back that we had before COVID hit us. So thank you, everyone, and we'll see you again next month.